Welcome to Community Health Heroes, where we spotlight local leaders and organizations that provide much-needed health and wellness resources and information. Our hope is for everyone in our community to strive to live healthier, happier, and longer lives. I'm your host, Leslie Snedowski. Thank you for joining us. The United Health Foundation announced a 3-year, $1.2 million grant to launch an innovative program at Women's Hospital in Baton Rouge to address the needs of pregnant women with opioid addiction and their affected newborns, and treat infants born with neonatal abstinence syndrome. Dr. Kevin Stevens, the Senior National Medical Director of Clinical Services for Optum Population Health Solutions and Prevention, and Emily Stevens, the Director of Care Management at Women's Hospital, will join us to talk about the new GRACE program that stands for Guiding Recovery and Creating Empowerment. New program services are designed to support expectant mothers by providing comprehensive care coordination services specific to their needs during and after pregnancy. And the Great American Smokeout is taking place on Thursday, November 15th. In case you need some extra motivation to stop smoking for good, make sure to watch our interview with Jim Pittman from the Smoking Cessation Trust. You'll learn more about the local resources available to help you kick the habit. At the New Orleans Botanical Garden in City Park, you'll find a new sculpture installation by the world-renowned glass artist Dale Chihuly. The 22-foot-tall rose crystal tower is beautiful to look at, but can it also be good for your health? We'll explain in our Community Health Heroes report. And with Thanksgiving upon us, are you thinking about incorporating some nutritious options to serve at your dinner table? Erin Washington with local menu Nola will be in the kitchen for our Eat Fit Nola cooking segment with some scrumptious stuffed avocados and sweet potatoes that provide a healthy spin on traditional Thanksgiving side dishes. So don't go away. We'll be right back with more Community Health Heroes.
17 years ago, when I decided to become a mentor, that I was assigned to Christina. When she was in the first grade, she was a shy little girl, not able to smile much.
Elaine showed there were people out there to help me and guide me through life. When Elaine let me read her diary, I didn't even realize how important I was to her. And now that I'm mentoring, I feel that importance, and I can spread those same values to the girls I mentor.
Be someone who matters to someone who matters.
Welcome back to Community Health Heroes. Did you know, according to the Centers for Disease Control and Prevention, opioid use by pregnant women represents a significant public health concern, given the association of opioid exposure and adverse maternal and neonatal outcomes, including preterm labor, stillbirth, neonatal abstinence syndrome, and maternal mortality. With us now are Dr. Kevin Stevens, the Senior National Medical Director of Clinical Services for Optum Population Health Solutions and Prevention, and Emily Stevens, the Director of Care Management at Women's Hospital, to talk about the GRACE program that's geared to help opioid-addicted pregnant women and their newborns. Welcome to the show.
Thanks for having us.
Thank you for having us.
Emily, let me start with you. Tell us about the GRACE program.
GRACE is a care coordination program for pregnant women who are struggling with opioid use. GRACE stands for Guiding Recovery and Creating Empowerment, so we envision it as a network, a place where women can come and be connected to all of the different community services and providers.
And Dr. Stevens, how can this United Health Foundation $1.2 million grant help women addicted to opioids in Louisiana?
So the $1.2 million is really help to get what we call a wraparound service, where we can get the doctors, the nurses, the psychiatrists, the community players, all to help the mother and the child get through this problem.
Can you tell our viewers how big a problem this opioid problem is, specifically for pregnant women in Louisiana? I mean, it's a growing problem.
It is so huge. I mean, over the last, from 2003 to 2013, we had a big increase, like a fourfold increase. Even at Women's Hospital, They have had a 67% increase in their neonatal abstinence syndrome in their patients over a few years.
Emily, it's probably natural that this program started at Women's Hospital because you deliver a lot of babies there, right?
We do. We're actually the largest delivery service and largest NICU in Louisiana.
Wow.
And so recently we've seen an increase in the rate of neonatal abstinence syndrome at our hospital. And so that we knew that we had to do something, and in us doing something that we could really be part of the solution and make an impact for the state.
Dr. Stevens, how are newborns affected by maternal addiction? You mentioned a little about the syndrome. Could you tell us a little more about it?
Neonatal abstinence syndrome, it's when the babies have to withdraw from the opioid addiction from the mother, and so they can have tremors, they can have convulsions, you can have an increase in SIDS, sudden infant death syndrome. So that's why it's so important that we identify these mothers early in the pregnancy, and then that way we can help them have the treatment that they need to minimize the impact on the child.
Oh, that sounds horrific, and I know there's also this stigma about being addicted to opioids. How does the GRACE program help women get over that stigma?
So we work with women and teach them that opioid use disorder is a chronic relapsing disease. And then we also work with our hospital staff and our treatment providers also to educate them on that opioid use is a chronic relapsing disease, and to reduce the stigma or the thought that this was a moral failure or a choice by the individual.
How can women in need participate? How do they get started?
Yeah, so they can be referred by their obstetrician, or they can be referred by their primary care doctor or another community agency that they're engaged with, but they can also call themselves and enroll in the program.
How are y'all determining what means success of this program? What benchmarks are you trying to hit, or what are you just seeing already?
We look for a healthy mom and a healthy baby. Like Dr. Stevens was mentioning, we try to get engaged with the woman as early as possible because that has been proven to show positive outcomes for both mom and baby.
And then we look at NICU, neonatal intensive care admits. We look at birth weights. So we're hopeful that we have increased weights in terms of the birth weight of the infant, as well as decreased days and decreased admissions to the neonatal intensive care unit. And those are some really hard metrics that we can use to follow to see the success of the program.
And I know that the program is still, at its early stages, but I mean, have you seen some hard outcomes already? It's something that you can say, wow, look at the changes we've already been making?
We've only been open for about 6 weeks to 2 months at this point. But we've had a lot of women discuss with us that they felt much more comfortable attending their appointments or engaging in treatment and recovery because they had the support from the program.
It's a greatly needed and badly needed service, so we're just so happy that this is there.
Tell our viewers how they can learn more about the GRACE program.
You can learn more by going to our website. It's womens.org/grace, or you can call 225-924-8574.
When the word gets out, I'm sure more and more people will be coming to and approaching and hopefully be a part of it and hopefully make their lives a lot better.
Yeah, and I just to say that the stigma is really a big problem, and so we tell our listeners that, look, if you have a problem, no problem. Just come in and let us work with you. We all have ups and downs, and so it's not a stigma. So it's a problem we can address, so work with us and we can work with you to address it. So thank you very much for having us here.
Oh, our pleasure. And please come back
you.
maybe in a year and tell us about some of those metrics and how many people you've helped.
Sounds great.
Thank you.
Thank you again. When we return, how to find the local help you need to stop smoking and all about the Great American Smokeout. We'll be right back.
After 15 years of smoking, Eva Marie quit. There's a new lung cancer screening that could save her life. You stopped smoking. Now start screening. Learn more at savedbythescan.org.
Welcome back to Community Health Heroes. Did you know the American Cancer Society's Great American Smokeout takes place on Thursday, November 15th? Quitting smoking isn't easy, but event organizers say it's the best time to join thousands of smokers around the country to start your journey towards a smoke-free life and reducing your cancer risk. With us now is Jim Pittman with the Smoking Cessation Trust to tell us more about the Great American Smokeout and local resources you can use to quit smoking for good. Thank you for joining us today, Jim. Good to see you again.
Thank you for having me, Leslie.
I want to hear all about the Great American Smokeout coming up this Thursday, November 15th, and why it's such a great time for people to kick the habit.
Well, the Great American Smokeout was founded by the American Cancer Society. It happens one day every year, and it's usually the Thursday before Thanksgiving. And it's one day in which the Cancer Society and healthcare professionals throughout the country encourage smokers to quit cigarettes for one day.
And so you've mentioned the Smoking Cessation Trust. Can you tell us a little more about it and how our viewers can become a member of what's called the Scott Class?
Well, the Scott Class is a result of a class action lawsuit with the tobacco industry, in which the Smoking Cessation Trust was awarded millions of dollars to help Louisiana residents that started smoking before September 1st, 1988, that's the Scott Class, to quit for free. Included in membership, and we now have over 94,000 smokers have signed up since 2012.
It seems like the numbers are growing, though, for younger people starting smoking. Is that because of all the new ways to start smoking, like vaping? And is that something that's becoming more attractive to youngsters?
E-cigarettes is playing a huge role in getting teenagers addicted to nicotine. Now, what the e-cigarette manufacturers will say, and many of them are owned by the tobacco industry, is that, well, we're trying to help people, we're serving as a cessation tool, but for these teenagers, they've never smoked or were never addicted to nicotine before. So it's important that our legislators, especially in Louisiana, look to at opportunities to reduce the amount of teens that can purchase these types of devices.
And there's some sort of legislation down the pike you think that might help?
You know, what we're finding out is around the country, there are states, there are cities, there are counties that are passing this legislation that makes it much more difficult for teenagers to purchase tobacco products and nicotine products such as e-cigarettes and that sort of thing, at least until they're age 21. What we understand and what the experts understand is that most people get addicted to nicotine and get addicted to cigarettes in their teen years.
Why do you think it's so hard to quit smoking, and why the Great American Smokeout is such a great event for people to take part of to kind of help them bridge that gap?
What's important is that you have professionals working with you who understand the addiction, who understand that each person's treatment plan, each person's cessation plan is going to be a little bit different. And that's why we have experts working throughout the state of Louisiana with the Smoking Cessation Trust to help smokers who want to quit cigarettes and quit them for good.
How can our viewers find out more about the Smoking Cessation Trust?
First and foremost, they can go to our website at smokefreela.org and find out everything they need, smokefreela.org. They can also follow us on social media. We're very active on Facebook, LinkedIn, Twitter. So follow us there, look for the Smoking Cessation Trust. They can also call a couple of different numbers. Locally in the New Orleans area, they can call 529-5665, or statewide and toll-free, they can call 855-259-6346. That's 855-259-6346, the Smoking Cessation Trust.
Well, great. We're so glad to have you on again, Jim. Thank you so much, and congratulations. It looks like your hard work's definitely paying off. Those numbers are really high.
Thank you very much for having us, and this would not be possible without healthcare influencers like you throughout the state that are helping to get the word out about this wonderful free program.
Well, thank you, and thank you again for joining us. When we return, a look at the newest sculpture in City Park and what health benefits it may provide.
I guess sometimes things just happen. Devastating things. Your whole world changes in an instant. That's what happened to me the day my mother had a stroke. I'm Paul George, and I want you to spot a stroke fast. F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911. Protect the ones you love. Spot a stroke fast.
Welcome back. Did you know that recent global studies and research show that looking at art can be beneficial to your health? Whether you're in an art gallery, a museum, or outside looking at public art, you can lower your stress levels, decrease your depression, and even strengthen your critical thinking skills. This November, the New Orleans Botanical Garden at City Park unveiled a giant 22-foot-tall Dale Chihuly rose crystal tower sculpture. Underwritten by the Hellas Foundation, this installation is a marvel to behold. Plus, looking at it may make you feel better. More about this new art in the park and about art therapy in our Community Health Heroes report. Can looking at this multifaceted, large-scale sculpture improve your health? On Friday, November 2nd, the Hellas Foundation unveiled this 22-foot-tall rose crystal tower by world-renowned sculptor Dale Chihuly. It's in front of the New Orleans Botanical Garden in New Orleans City Park. And it's made of pink polyvitro, the artist's term for a plastic material with similar visual properties to glass. It looks like a giant piece of pink rock candy, and it's on public display through November 2020. But do public works of art like this one have hidden health benefits? Louisiana art therapist and licensed professional counselor Holly Wary says yes.
So research has shown that when people participate in looking at art, and art making as well, but also just having the experience of taking in art in public spaces, that they're able to reduce levels of anxiety, they're able to relax better, and just to have a happy experience. That you can see that through levels of dopamine rising, which is a pleasurable experience for people.
Wary says art therapy is a mental health profession that uses art making as a form of communication to facilitate mental health, physical health, and happiness. Wary is the founder and executive director of the local nonprofit Whole Village Art Therapy, where she uses art supplies like these to provide art therapy at schools, community centers, and summer camps. She says the healing property of art making can help with stress, depression, communication skills, and build self-esteem.
Especially when we do things with Whole Village Art Therapy, when we do our big community events, bringing people together around art making gives them a way to talk that they may not have before. And so with that practice, then they can go back into like other situations and use those skills that they obtained through the art making. And art is just a different way to express oneself. So sometimes, you know, it's that feeling when you come home when you're like, I don't want to talk about it, but maybe you want to make art about it. And so people have a lack of communication sometimes around different things, and art can be a better form of communication for a lot of people.
Wary says you don't have to be a Pablo Picasso to engage in art therapy, and that you aren't expected to create a masterpiece.
No, art is for everyone. What I tell people is that you don't have to be good at art. You don't even have to like it to participate in art therapy. And another thing that I always tell people too is that your art does not have to be beautiful. And a lot of times art that's made in art therapy is not beautiful because a lot of the kids I work with have severe trauma. Their life is not always beautiful. There are many beautiful moments, and we create those as well. But, you know, art can be ugly because sometimes life is ugly.
With so many museums and galleries and public works of art like this Chihuly, Wary said art is ingrained in the culture of New Orleans, and we should become more aware of the healing power of the art around us.
I think sometimes people think that when they go to the museum, they're doing it wrong. And there's no wrong way to do it. There's no wrong way to look at art or observe it, or sometimes people are really hesitant to say anything about it because they think, oh, my opinion, my feeling is wrong. But I don't think there's any right or wrong way to do it. I think one important thing that people don't always do is to be mindful. So to be mindful that and be present in that space and really connect with the art. And I think that's hard for anyone to do with not just with art, but many things in life.
Wary said the way the sunlight dances around the dimension of this rose crystal tower can make an observer stop and think about it for a longer period of time, to reflect and benefit from the hidden healing powers it may have. So the next time you're in City Park or in front of any piece of public art in the city, stop, take a photo, and a long, thoughtful look.
sometimes people don't think about how important art may be, or that it is something that would be very therapeutic to them or would make them feel a lot better.
Most party fouls are pretty dumb. But if you decide to drink and drive underage, you could lose your license and your freedom. Underage drinking and driving, the ultimate party foul.
I'm Molly Kimball, registered dietitian and founder of Oxner's Eat Fit Nola. We've collaborated with more than 100 partners locally to create Eat Fit Nola, a partnership that highlights the better for you items right there on our restaurant's menu or on grocery store shelves, making it effortless for you to dine at your favorite restaurant or shop your favorite market without ditching your otherwise healthy diet. Every month, Community Health Heroes Show, which is sponsored by the United Health Foundation, will shine a spotlight on an incredible chef to help show you how you can make smarter food choices to live a healthier, happier, and hopefully longer life. In addition to Eat Fit Nola, you can find our partners such as Eat Fit North Shore, Eat Fit BR, Eat Fit Bayou, and coming soon, Eat Fit Acadiana in a neighborhood near you. So don't go away, Community Health Heroes will be right back.
Forget the turkey. Let's talk about the savory stuffing, the fluffy potatoes, and the candied vegetables. Thanksgiving side dishes usually steal the show on any tabletop. But did you ever consider making them the healthiest part of your meal? With us now is Chef Erin Washington with local menu Nola and Eat Fit Nola ambassador Emily Eickoff. They're here to prepare some stuffed avocados and sweet potatoes and tell us why they're delicious and nutritious. So thank you both for stopping by.
Yeah, thanks for having us.
I'm so excited because I love Thanksgiving. I know everyone does, but I love Thanksgiving. It's my favorite holiday. Chef, why do you think Thanksgiving is such an important meal?
For one, I think it gives an opportunity for like family members to come together and just have like, just this gathering of just eating, just, traditional healthy Thanksgiving meals.
And tell us a little about what you're preparing today.
Today we have just some char grilled turkey breasts. I have baked sweet potatoes, and we also have our stuffed avocado.
But I also want Emily to chime in to tell us about the typical Thanksgiving meal. I hate to ask, how many calories do you usually consume during a Thanksgiving meal?
Yes, it's actually quite surprising. You can consume up to like 3 days worth of calories, so almost 4,000 in just one meal. So, while we love to celebrate and have that gathering together, we don't really need to give up our diet or our, healthy eating to do it.
And that's where Chef Erin comes in, right?
Correct.
So are you going to start with the avocado or the sweet potato?
I'm going to start with the sweet potato. So here I have like just some marinated turkey breasts that I put in the grill here.
That's a big turkey breast.
Yeah, and we have to have enough for everybody. So, so then we take just some diced sweet potatoes, and this is a mixture of just some low sodium, Mrs. Dash, some pink Himalayan, and then we also have some black pepper, and we just kind of like sprinkle that on there, and then we have some olive oil, because we're going to throw this in the oven, and we want that coated with some olive oil to kind of help, speed up the baking process. And then we just get in there and dive in and toss it by hand.
That's the fun part.
Make sure all the flavors all incorporated with the sweet potatoes. And so you can either do it two different ways. You can bake your sweet potato, or you can dice it and put it in the oven. So we have here, this is a diced version. And then I have some finished up turkey breasts that I'm just gonna like stuff that in there just like that, because it's a good eye popper of a dish, right? So.
Well, Emily, I'm sure you have a lot to tell us about sweet potatoes. They're supposed to be super, super good for you, right?
Yeah, they're actually one of those superfoods, and you can tell by their vivid orange color that they're phytonutrients. So they're full of vitamin A and beta carotene, full of fiber, very low in sodium, and high in vitamin C as well. So I love sweet potatoes, and I try to eat them at least once a week. They're very easy to make, just throwing them in the oven for an hour, and you have several days worth of sweet potato seeds.
Oh, that looks
really
super
great.
Easy. And I know you just garnished this. It
Yeah, I just garnished it with some dried cranberries, some toasted pecans, and we have the turkey breast working in there. But then I'm going to finish it off with an all-natural sweet potato honey butter that I picked up on my son's field trip to Liuza Land. So that's just gonna, create an alternative from your, normal canned cranberry sauce. But this is an all-natural honey butter made from sweet potatoes, and it just adds a perfect taste to this dish.
Yeah, and I've never heard of that before, and I'm definitely going to pick some up because that sounds really, really good. So just this particular dish, I mean, this is like Thanksgiving on a plate right here. All the good stuff's right here. Nutritional breakdown?
Yeah, so like all of our Eat Fit dishes, it's going to be very high in fiber, very high in protein as well, and no added sugar or less than a tablespoon of added sugar, and things like that. So we really love what Chef Aaron has done here in creating kind of a non-traditional Thanksgiving side for us. Yeah.
With the turkeys, so that's kind of like your main, and these are, and your avocado is going to be another side?
Yeah, avocado is another side. Let me just doctor up this spoon. But yeah, we take just a whole avocado and then we mash it up. And it's kind of like, just a alternative from eating, those deviled eggs. So this is a little bit more bite to this. So you get your avocado shell and you use it to kind of as a bowl.
You scoop it out, mush it up, and you put it, it's like a restuffed avocado.
Yeah, absolutely. So that just sits in there like that, and then you can take some toasted pecans to kind of add some texture and crunch to our stuffed avocado, and some more of this delicious honey butter just to add.
So good.
I'd slather everything in there.
Everything, yeah. It goes on everything. It's like, everything. It goes on good. So, good to go.
Wow, and that's the finished product right
Finished
there.
products right here, yep.
That's beautiful. I know one other big thing that you focus on in your business is your outreach to at-risk youth. Could you tell us a little how that comes into play?
I have a 13, 9, and 3-year-old, so if I could somehow be an influence to my neighborhood and my community, by teaching kids or how to, create dishes like this.
Tell us a little about your business and how people can find out about it.
We're located in the Rue Carré's Outdoor Food Hall. We're open up 6 days a week, and you can find out more information on Instagram at Local Menu Nola or at Local Menu Fit.
And Emily, tell us about how our viewers can find out more about Eat Fit Nola.
Yes, so they can actually go on our smartphone app and find directions to Local Menu Nola, find out all the Eat Fit options that are being offered there, and also the nutritional criteria such as the calories, the protein, and the fiber and all that. So I would suggest everyone to go and download our Eat Fit smartphone app.
Well, thank you so much. I'm sure you inspired a lot of our viewers to maybe prepare a separate side dish. Might be a little healthier, but just as beautiful on the table. So thank you both very much.
Thank
and
you.
Happy Thanksgiving.
Happy Thanksgiving. Thanks for having us.
And we'll be sharing your recipes on our Facebook page and our website at communityhealthheroes.org. We'll be right back.
Hart, what's going on? I'm leaving. Why? What did I do? Not enough. You constantly ignore me. You barely eat anything healthy. You're half as active as you used to be. The pressure is just too much. I quit. Okay, I get it. I'll do better. Just please, don't leave. Okay, but remember, if I go, you go.
Listen to your heart. Don't let it quit on you. Uncontrolled high blood pressure could lead to stroke, heart attack, or death. Get yours to a healthy range before it's too late.
Thank you for joining us. If you would like to suggest a health topic, send us information on your health organization's events, or recommend your favorite Eat Fit Nola restaurants, please visit our Facebook page or email us at communityhealthheroes@gmail.com. If you'd like to learn more about our guests and share segments from our show, check out our website at communityhealthheroes.org, and you can also find our show on YouTube. We hope the information we provided you about the United Health Foundation's $1.2 million GRACE program, the Great American Smokeout and the Smoking Cessation Trust, how stopping to enjoy public art can keep you healthy, and how to prepare some nutritious Thanksgiving dinner side dishes will help you and your family live healthier, happier, and longer lives. I'm Leslie Snedowski. Make sure to join us next time for more Community Health Heroes.